Good evening, everyone. Could we ask everyone to please take their seats? Okay. We're going to begin our program in a few moments, so we're going to ask those in the back of the room to please take their seats. I'm not sure if they can hear us. Nice to see you. Good. Once again, we're going to ask everyone to please take their seats. We're going to begin our program momentarily. Also, if everybody could turn their cell phones either to silent or turn them off. We are providing a live stream for today's event. So what we'll ask is that when it comes time for questions and answers, that you will please come to the front of the room. There is a microphone, and you could speak right into the microphone for the questions and answer portion. Okay. Once again, we're just going to ask all those that are at the exhibit section, if you could please join us in the front of the room. We're going to begin our town hall. Okay. Are we ready? Okay. Good evening, everyone. My name is Angelo Valente. I'm the Executive Director of the Partnership for a Drug-Free New Jersey. And I'm very pleased to be here today on this beautiful evening. But to see so many people here, and it's always encouraging when we have to pull more chairs out to accommodate all those that are in attendance today. So we do appreciate all of your participation. I'd like to welcome everyone first to the Knock Out Opioid Abuse in Somerset Hills. And tonight's event is hosted by the Partnership for a Drug-Free New Jersey and the Horizon Blue Cross Blue Shield of New Jersey. We want to thank each and every one of you for being part of the solution to this statewide epidemic. By being here tonight, you're part of the solution. And the Partnership and Horizon is also pleased to recognize and thank our collaborating partner here in Somerset, Community in Crisis. Andy, Tony, Claudette, and Jody, who's going to be on our panel. You are all fortunate to have these four and many others that are part of Community in Crisis that are leading the effort and bringing so many wonderful programs to your community. The Partnership and Horizon has embarked on a new 2-year Knock Out Opioid Abuse series. And the series is to address the epidemic through community outreach, prescriber education, parent awareness, and a statewide media campaign. This is the 8th of 21 Knock Out Opioid Abuse town halls that have been held, one in each community in each one of New Jersey's 21 counties over the next 2 years. New Jersey and Somerset Hills is in the midst of an opioid abuse epidemic. There's not a day that goes by that we don't hear or see a story in our local news about the misuse of prescription medication, heroin abuse, and unfortunately the countless overdoses impacting all of our communities. So many families are dealing with this on a day-to-day basis and the challenges in dealing with the crisis of the disease of addiction. In Somerset County, from January through September, law enforcement and emergency medical personnel administered the antidote naloxone 171 times, an average of 19 times per month. 71% of these naloxone administrations involved in-county residents. So we know that this is an epidemic that affects people in every community in every part of New Jersey. Fentanyl, which as many of you know is a synthetic opioid 80 to 100 times more potent than morphine, has played a major role in the rise of opiate deaths in our country and in our state. In 2018, 60% of the suspected heroin lab submissions from Somerset County contained fentanyl. That was up 8% from 2015. And we want to thank our additional collaborating partner, the New Jersey State Police, who's represented tonight by Captain Dan Engelhardt, and he has been such a great supporter. He's attended all of our town halls and provided this great information. So let's give him a round of applause. There he is. The Somerset Hills community, no community is immune, no family is immune, and today we gather to learn how a community can make a difference in fighting this crisis. How can we prevent more New Jersey residents from becoming addicted? How can we reduce the stigma of addiction? How we can help those who are addicted, how we can support those in recovery, and how we could bring awareness to this crisis. Now, we know there's no easy answers to solving the opiate epidemic, but there are ways we can all make a difference. And tonight, just by being here as parents, community leaders, students, and residents, working together and developing ways to end the epidemic and change public attitudes, we are making a difference. It's now my pleasure to introduce the sponsor for today's town hall, Horizon Blue Cross Blue Shield of New Jersey, who's represented tonight by Chris Barton, Clinical Design Liaison for the Behavioral Health Division. Chris?
Thank you, Angelo. Hello. It's my honor and my pleasure to be here this evening to speak to you on behalf of Horizon Blue Cross Blue Shield of New Jersey and to welcome all of you to this very important town hall focusing on the opioid epidemic. Thanks, Angelo, for your introduction and for your leadership, and thank you, all of you, for your interest and your attendance in this event. Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for Drug-Free New Jersey to bring you this town hall meeting. This initiative is part of our company-wide response to address and help this public health crisis and this public health crisis in our state. Since the foundation's inception in 2004, we've awarded more than 1,500 grants to nonprofit agencies. However, none are more important and more vital than our grant to the Partnership for the Knock Out Opioid Abuse initiative. This grant represents a large portion of the foundation's $1.3 million we've invested to provide support for opioid prevention and education programs to help families and our members. The opioid epidemic impacts every community in New Jersey, as Angelo said. With more than 3,000 drug-related deaths in New Jersey in 2018 alone, it's clear that more needs to be done. We need more people to become part of the solution. Through our collaboration with the partnership and other state and local nonprofit agencies, we are committed to using the Knock Out Opioid Abuse campaign to combat the opioid epidemic. Tonight, you'll hear about the impact of the opioid epidemic in your community and the steps that many are taking to address the crisis. Again, I want to thank Angelo and the Partnership for Drug-Free New Jersey. I want to thank the Bernards Inn for hosting and for the community in crisis for collaborating with us to present the town hall. Thank you.
Thank you, Chris. At this time, I'd like to represent some of the leaders from our local communities. We have Bernard Township Mayor Carol Bianchi. Carol? So we have Bernardsville Mayor Mary Jane Canos, and we have Bernardsville Councilman Dr. Jeffrey Hammond, who's here with us today. So thank you all for joining us. Today's town hall is not only about hearing from our panel, but from all of you, members of the community. We want to share the experience of the epidemic and how it's affecting you, what's working in our community to address the issue, and what's not. Questions you might have, recommendations you want to share. It is vital that we hear your feedback, and we would encourage people to please, as I mentioned before, come up to the microphone and ask questions of our panel once they've completed their programs. The information you provide will help us understand how the opioid epidemic affects this community and every community, and it'll help the partnership and Horizon to more positively make an impact on future knockout abuse town halls and future programs. It is my pleasure to introduce a great group of panelists that we have with us today who will provide some comments, and then we have some questions that we received from the audience ahead of time, some questions from live stream, as well as the questions from all of you here today. So our first panelist is the Somerset County Prosecutor, Michael Robinson. Michael. Our next panelist is Dr. Gail Gronowitz, who's a Basking Ridge resident. Dr. Gail. Next, we have the founder and board chair of Community in Crisis, Jody DiAugustini. We have a Bernardsville resident in long-term recovery, Amanda Carroll. Another local resident, Katie Myler, Bernardsville resident. And we also want to welcome Father Rick Morley from St. Mark's Episcopal Church. We're going to begin tonight by asking the prosecutor a question. Can you outline from a law enforcement perspective the impact of the opioid crisis in our community here?
Yeah, before I do that though, I do want to thank and welcome some of the law enforcement community that are here. Chief Kevin Valentine from Burnsville, Chief Mike DeCarolis from Far Hills, Chief Carl Rock from Bedminster, Chief Mike Shimsky, and a whole host of other officers, Sweeney, Ward, whoever else is back there. You guys, thank you. And I don't make light of that, I'm just joking, because these men and women are the boots on the ground, and they're the ones in our communities seeing every day what this epidemic is doing to our community. So to answer your question, so let me just back up for 1 second. So I was an assistant prosecutor in Essex County for 3 years. After that, I was an assistant U.S. attorney for 8 years, and then I got this position in 2016. So every day I would commute from Basking Ridge. I was born and raised here pretty much, went to Ridge High School, and I'd commute via 78. And I was never ignorant every time I went into Newark to think for a second that Somerset County, and in particular, Basking Ridge, Burnsville, the north part of Somerset Hills, did not have a drug problem. But when I got to this position, I was candidly shocked by the magnitude. And I'll share with you one little story that really struck a chord and kind of for me said, all right, I really have to hit the boot or hit the ground running with this. I was at Robert Wood Johnson in Somerset. There was a meeting, there was an ER nurse there. She had no clue who I was, where I was from. We were talking about this very topic. And she got very emotional talking about the scores of young men and women coming into the ER that were suffering from an overdose. And the first town she mentioned was nowhere down in Manville or Somerville or some of these places that people think where it is. She said, they come down the mountain from Basking Ridge and Bernardsville and Far Hills. And again, she had no clue who I was. She didn't know where I lived. And I spoke with her for a little bit. And to me, that was, again, a bit shocking because I wasn't ignorant that we had a problem. But the fact that she named our towns as kind of the #1 area that had this problem where they were literally dumping kids off in the street so that they wouldn't get caught by police and go on their way. So to answer your question, what are we doing from a law enforcement perspective? We will continue to fight the battle on the coastal front, that is the ports of Newark and Elizabeth, where all this heroin comes in. Unfortunately, New Jersey is known not only for tomatoes and corn, but we have the purest heroin in the nation. The reason being is because when it comes over from overseas through the ships and the cargoes, it has not been cut with any additives, baking soda, what have you. And so trucks as far west as California will come out to New Jersey, into Newark. If you've ever taken a flight from Newark Airport and you look to your left when you take off, all those cargo ships, some of them are literally thousands and thousands of tons of heroin. And so the DEA, Homeland Security, local, state, law enforcement, we're all trying to do our best to combat that. And we will continue that fight. And we will administer severe penalties to those distributing heroin and other drugs for that matter. But the other thing that we're doing that's quite different, and I think it's long overdue, is those that are users, those that are possessors of drugs and things of that nature, we are trying to seek treatment for them. Because I can tell you, for being a prosecutor for over 14, 15 years, that is a revolving door. And just arresting them over and over and over, it does nothing to solve the cycle. So what we're trying to do is get them into treatment. We have things like drug court and other intervention programs, collaboration with other entities out there that are there for these folks that need help. And I don't know Amanda, but quite frankly, she's the one that everyone in this room should be listening to most closely. And I give her a ton of credit for getting up here and talking to all of you, because I've met hundreds and hundreds of people in recovery, and they are heroes to some degree. They really are, because it affects everyone. You led off with how this problem affects everyone. I've met people in the Burnsville Mountains that live in $10 million homes to the blue-collar neighborhoods of Manville. And I'm telling you right now, doctors, lawyers, I see clergy here, I've met them all. I've met every person you can imagine that has suffered from some form of substance abuse. And so, a long-winded answer. We're doing a lot, and a lot of it involves collaboration with other groups in attacking the issue.
Excellent. Thank you, Prosecutor. Our next question for Dr. Gronowitz. Could you discuss the opioid epidemic from a public health perspective and what the medical community is doing in response to the epidemic?
Sure. Okay. So good evening, everyone, and thanks for coming out on this beautiful evening in the Somerset Hills. I'm Dr. Gail Granowitz. I'm a practicing anesthesiologist, a board-certified anesthesiologist. I live in Basking Ridge and have for 25 years. I work exclusively in the operating room doing cases. I'm not a pain management physician, so I do not prescribe opiates. I mean, I can prescribe, but I don't prescribe opiates, just so that you know, in interest of full disclosure. So the question is can I talk about the opioid epidemic as a public health issue, and what are we doing about it in the medical community? So what is public health? Well, public health is, the definition of public health is any health-related issue that affects the population as a whole. I think we would all agree that this would qualify for that. And I think the federal government just declared that this was a public health emergency, in fact, the largest public health emergency that we have in our country this year. I want to give you a couple of statistics, and I'm sorry for not writing nice note cards like Jody, but I just pulled out slides from an old presentation. Here in New Jersey, you know, in the last few years, we've had a massive jump in overdose deaths. And that's much higher in terms of percentage averages than the rest of the nation. A couple of statistics that are a little shocking. The United States makes up 4% of the world's population. We consume 80% of the world's opioids. So the question is, how did we get here, okay? And I think it's important to look at that before you answer the question of what are we doing about it now. So in 1995, you know, the government decided that pain would be added as what they call the fifth vital sign. And the vital signs are blood pressure, heart rate, respiratory rate, oxygen saturation, and now pain was going to be added. And they added what they call the pain scale. And I'm sure anyone who's ever been a patient or read the newspaper, or if you're not living under a rock, you know that the pain scale is the most highly, possibly the most highly subjective question you can ask next to, do you love me? And so from 0 to 10, the pain scale, 0 being no pain, 10 being the most excruciating pain of your life. So I could ask Jody, and she could have a hangnail, and she could say, well, my pain is an 8. And what do I say? No, it's not. I mean, if I had a hangnail, my pain might be a 1/2, you know. So the bottom line is, in 1995, though, CMS decided that pain was going to be the fifth vital sign. And that's when you started, between 1995 and 1999 is when you really started to see the uptick in opioid prescription and opioid consumption by our country. And we were also told as physicians back then that we were going to be evaluated by insurance companies and the government on how well we treated pain, how efficacious we were on treating pain, and that the conventional wisdom at the time was that pain meds, opioids, were not addictive, and that was fueled, as we all know now, if you read the newspaper, by clear faulty evidence on behalf of the pharmaceutical companies, direct-to-consumer advertising, the dark web, Mexican cartels, everything came together to kind of create the perfect storm. So, well, why do we care about that? Well, we care about that because prescription opioids are the source of where non-used prescriptions are the main source of where people get opioids. And 80%, 3 out of 4, or about 80% of heroin users started out using prescription opioids that were not necessarily their own. The reason this is a public health problem, too, is that if you look at all demographic groups, ages, races, male, female, et cetera, heroin use is increasing across all demographic groups, not just one group, not just the young people. I mean, you see a young person's bedroom back there, but that could really be anyone's bedroom. And heroin addiction and overdose deaths are really climbing in this country, and especially in New Jersey. Let me just see if there's anything else here I wanted to say about that before I tell you what we're doing about that. Yeah, a couple of other interesting statistics. So Johns Hopkins did a study 2 years ago. They looked at 810 patients undergoing 7 different kinds of surgery, and they simply asked the question, if you were prescribed opioids at what they consider the end of the recovery period, which is 90 days, how many of you still have those opioids? What do you think? You think it was like 10%, 50%? As much as 92% of people still had those opioids after the recovery period was over with. So now you got it. It's in your house. It's in your medicine cabinet. So people keep those things. Okay, that's one thing to keep in mind. The other thing is, if we looked at a nationwide data set. We took 36,000 patients, we looked at they were having 13 different kinds of surgeries. And these are patients who are opioid naive, who were not taking opiates before having surgery. But after the surgery, they found that the continued use, which is after the 90-day period, was as high as 6.5%. So you take a patient who just maybe had a bunion, who never had opioids before. They have bunion surgery. You get some opioids. It hurts. And then after 90 days, you're still using those opioids. So and that statistic is a little higher, or can be as high as 13% in adolescents, for example, getting things like opioids for wisdom teeth. And it was the same, interestingly enough, for both what they called major and minor procedures. So let's say you have your colon out, that's a major intra-abdominal procedure, or you have a bunion, that's considered a minor procedure. Doesn't matter. You get the opioids, it doesn't matter. So that's kind of where we are. So now the answer to the question is, well, what are we doing about it? Well, interestingly enough, when I first started with Community in Crisis with Jody in 2014, we found that the medical community really didn't know that much, or wasn't really that educated unless they had a particular interest in this. So we're talking about it. The last 2 years, my professional society, which is the American Society of Anesthesiology, and my component society, the Society of Ambulatory Anesthesia, had a whole, at our meetings, at our national meetings, we had an entire session on the opioid crisis, what are we doing, and what can we do better. And I spoke at the meeting this past year. So we're talking about it. We're trying to educate ourselves. That's the number one thing. The second thing is, we are using now, and this is mostly the standard of care at hospitals, surgery centers across the country, what's called multimodal analgesia. And what that means, basically, it's a narcotic reduction strategy where instead of prescribing opioids as a first-line drug, you use Tylenol, acetaminophen. You add in a non-steroidal, Advil or naproxen or whatever. You use other adjuvants. Intraoperatively, we use lidocaine, dexamethasone. We give ketamine sometimes, little bits of drugs to hit the pain at all the different pathways, both supratentorially and the spinal cord. So we add those drugs in, and we try to tell patients now, when you go home, before you take your opioid, get a nice baseline of pain relief. Take Tylenol and Advil together round the clock for 3 days, let's say if you have a knee scope, and then you need to add in those opioids if you need it. So we use multimodal analgesia as a standard in our surgery center, and I think most surgery centers do too. The other thing is, and very importantly, and this is something that I was able to institute in my own surgery center, we have 3 centers. Basically, we do 25,000 cases a year, so we're pretty busy. We have developed standards and guidelines, both procedure-specific and specialty-specific. So some of the major work has been done at the University of Michigan and at Johns Hopkins. They convened multiple panels over the last few years, and really last summer, about a year ago, in Johns Hopkins, they came out with really the landmark study, which was where they made recommendations. Like, for example, based on ENT, in the past, if you had ear tubes, you used to get a prescription for opioids. Now the recommendation is 0 opioids. And the panels were made up of doctors, nurses, adjuvant healthcare providers, and patients who said, I didn't need any of this. I didn't even take any of it. So those studies have come out, and now at my surgery center, we have prescribing guidelines. So, for example, in the past, Dr. A has a knee, does a knee scope, and he could write 50 opioids. Dr. B could write 10. Well, now the recommendation for a knee scope is 10 or less, 10 or fewer number of oxycodone equivalent pills. So we've come out with standards, and the surgeons are really following that. The other thing is now to renew your medical license, which is state by state, but in the state of New Jersey, You renew it every 2 years, and there are certain CMEs, continuing medical education units, that are requirements, like end-of-life care and that kind of thing. Well, now, as of last year, 1 unit is on opioid addiction and the opioid crisis, so that's really important. We also have the, I'm sorry, I'm almost done. The National Prescription Drug Monitoring Program. You register as a physician. If a patient has opioid-seeking behavior and they're seeking opioids from different doctors, then you'll get a letter, hey, Mr. Smith that you prescribed oxycodone to also is getting it from Dr. X and Dr. Y, et cetera. So it's a way of monitoring it. And, you know, there are some new laws. I mean, I know Tony Knoll, who's our executive person who can speak really about legislative issues. I know that now, if you're an opioid-naive patient, in other words, you're not on an opioid and you have, let's say, a knee scope, the doctor is allowed to prescribe you a 5-day supply before you need to see the doctor again. So that's a new law. It doesn't have a lot of teeth for enforcement, but it is an interesting concept. And finally, we're talking to each other, and most importantly, we're engaging patients in a dialogue. I mean, we're really talking to the patients about use your own multimodal analgesia. If you don't need all these opioids, don't take them. You know, you can partial fill your prescription. And patients are very, very interested in this conversation. When I say to patients, you know, before I anesthetize them, I say, you know, we use narcotic reduction strategy, and they're like, that's great, I love that. I don't want to take all these narcotics. So it's very much a dialogue between doctor and patient. I think that's the answer to that question.
Thank you, Doctor. I just want to thank you. I just want to add that the partnership is very proud that we help author that legislative package that included, as the doctor just mentioned at the conclusion of her comments, the requirement now in the state of New Jersey is that prior to prescribing an opioid, a medical professional, doctor, dentist, nurse practitioner, has to have a conversation with the patient or the parents of patients and provide information about the addictive quality of the drug, as well as any non-opiate alternatives that might be available for that particular procedure or a situation. We were the first state in the nation in 2017 to institute that particular law, and now, over the last 2 years, it's been adopted by 17 other states, and we have 8 other states that have just recently introduced that legislation. So we've been traveling around the country testifying on behalf of the legislation, and it's great to see New Jersey take that leadership role, and we're so pleased that the doctor mentioned that as part of her strategy with regard to local practices now, engaging the patient in that conversation. Thank you. The doctor also mentioned, or I think the prosecutor mentioned, the DEA, and we have a DEA representative with us here this evening who has a great in plain sight presentation, and it is available to come to your local community schools or other organizations you might have. So please speak to Tim afterwards, and the DEA and the partnership, along with many other organizations, also first hosted the first ever Take Back Day in the country back about 11 years ago that became the national model that we now have. And this coming Saturday will be, I think, the 22nd Take Back Day that's been established. So, Jody, in what ways has the opiate epidemic affected Somerset Hills community, and what are the unique challenges of this community, and how do we overcome those challenges?
Thank you, first of all, Angelo and Partnership for hosting us and collaborating with us, and the Horizon Foundation always for being great partners for us. That we wouldn't be here without you. You make us stronger and you make us better, and I thank you for that. And thank you also to the police and officials that came here tonight to support us and what we're doing here in the community, so thank you. So we started Community in Crisis. Now it's going to be almost 6 years in January, but it started after my daughter was a senior nursing student, had 2 friends overdose just 2 days apart. She was up at school, she pumped up her social media and called me and barely able to breathe. And that affected me greatly. That night I sat and I counted. Now this, you gotta go back to 2013, December 2013. No one knew what was going on. We didn't know there was a heroin epidemic. I didn't know it was heroin. She didn't know it was heroin. But I knew something was going on because I started to count that night, and in my little world, I counted 19 people that I either knew had passed away or were in and out of rehab centers for whatever reason. So even though we didn't have a problem, I knew we had a problem Because, in my anecdotal world, 19 is still a statistically large thing because I don't know everybody. And there were a lot of people that I knew that were affected with this. And these are only the people that I knew, because this is hidden. I mean, there's people amongst us that are suffering completely in silence, which is why we've still been doing this 5.5 years later, because we want to provide that support and bring those people out so they get treatment and help a lot earlier. I was talking, along my routine, I get a lot of phone calls, and one of the women called and said, a good friend of mine, and she said, as soon as I tried to share this with other people, because most people keep it to themselves, she said it was almost like people were ignoring me. They were walking away when I started to talk about it. So yes, the stigma is a huge problem. It is a disease. We're treating it as a disease, and we're trying to help these children, because I keep calling them children, get well. And I say they're your children, they're our children. And when we abandon them and we don't take them in and get them support that they would get if they had diabetes or some childhood disease that we would give them, we're not serving them well. We're not serving them as a caring community. That's what we're trying to do in community crisis. This is what this group here is doing tonight. I think in the past year, Bernards Township had 13 Narcan saves and 2 overdose deaths. That's what's reported. But I can tell you that I know people that have died in other parts that came and started their drug use here in the Somerset Hills and then died in other places in the country. I see the posts on Facebook, my friends' kids, and the Instagrams. I know what's going on, but you're never going to see all these things and you're never going to hear it. It's funny, I see an overdose, I've heard a child that died, and I purposefully look, and there's not an obituary in there. I can't even make sense of that. We've lost a 25-year-old, and no one's making note of that death. It's important to me. It's very important to their family. That person affected somebody. It was someone's child. So that's the part of this disease that's very hard to comprehend. I lost my own brother to cancer at 25, and we had 1,200 people come and support us. These families are all by themselves, struggling and with some shame and upset that not only that they died, but the way that they died. So yes, we know it's here in this community, but are the statistics always there and evident to what's going on, the magnitude of it? No, it's not. But we know, from what Mike and some of the police have provided us, thankfully we're getting more data to that effect. It's not a casserole disease, where people come and, if somebody's sick and you come and you try to support them. But shouldn't it be? Shouldn't we be changing it? The way to change this is to try to take the stigma out, get them help, give them the support emotionally and otherwise, financially as well, because this is taking a huge financial toll on homes. I just know of a family, again, that lost their home because they had to pay for, I think, the 7th rehab for this one child. So this is a huge toll in every way on families. It's affecting one child, but it's affecting the entire family. So I appreciate, again, the ability to bring this out.
Thank you, Jody. Thank you so much. Before we go on to Katie, I just want to also mention that continuing medical education requirement, which was part of that legislation, is also part of Knock Out Opioid Abuse Series 2, which we're doing right now. And the partnership in Horizon actually developed a webinar that's available to the medical community in order to meet the requirements of that 1 hour of the CME. So we're very pleased that that's part of this series as well. Katie, Amanda, could you tell us some of the barriers to recovery, and also what's been the most success in that process?
Is it up? Oh, it's already on. Oh. First of all, I wanted to say how thankful I am that I'm here tonight. It's pretty hard for me to fathom that I am sitting in this room. People wanted me to come here. They thought of me to come and sit up here. If you had asked me many years ago, as a Ridge student, I also am a Ridge graduate, I would have thought that the Bernardsville and Basking Ridge police were coming for me. That was the case a long time ago. And just to make sure we put it into focus, as a Ridge student, I had no problems finding access to drugs. None whatsoever. You name it, I found it. And if you name it, I could have told you where to find it. And I was a Ridge student. So for anybody that thinks that Basking Ridge or Ridge students aren't doing drugs, I may have graduated a long, long time ago, but I'm pretty sure they still are. And that continued. my experimenting drugs and alcohol continued for a long time. And I'm just saying that so we can have a picture and an understanding that by the time I was faced with the barriers to my recovery, I was around the clock drinker and using drugs, prescription drugs, mostly opioids. So the barriers to my recovery at the point in which I'd been using drugs and alcohol for 20 years was me. I was my biggest barrier. I had all the consequences, and the rap sheet had added up very, very long. But if you had asked me that the drugs and the alcohol, they are the problem, I would have said, no, look at all the bad luck I had. I got DUIs, everybody drives drunk. You're on my case, I don't understand why, look at yourself. I could not see that the real problem and everything was stemming from my drug and alcohol use. I could not see that. And even if I could see it, when I did notice it, I wanted that pain and sadness to go away, so I drank and drugged more. Because at the point in which I needed help, I had to actually admit to my innermost self that I couldn't stop drinking and drugging. And if I admit that, that also means that I have to accept help, I have to find the help, and I have to not drink and drug anymore. That was the only solution I had to coping with any feelings and coping with life. So if you took that out, I had no idea how to live. So needless to say, you're pretty scared. And so the barrier for me that I would say that affected me the most, that was the hardest one to break down, was me. Admitting that I had a drinking and drugging problem, and then asking and accepting the help that was there. Fortunately for me, I had a parent in a 12-step program who had a lot of friends. So I know who to ask, and I knew where to go, but until I was ready to accept that help, it didn't matter. I had to be willing to accept the help. And I was desperate at the time that I accepted the help. And to me, if it wasn't for that desperation, and if it wasn't for knowing that I knew where to go, I don't know how people that don't know where to go, what they do. I had all the resources there for me, and I was too scared. And if you're somebody that has no resources, that doesn't have a person, I don't know what you do. I guess you're even more scared than I was, and that's hard to imagine. So my greatest barrier, I would say, would be myself and hitting a point where I was willing to accept the help. What was the second part of the question? Is that a reasonable question?
It was just about some of
I did good.
the successes that you've experienced as well in your recovery. So,
Well, my success I would attribute mostly to my 12-step program that I'm in, and for the people that are within that 12-step program. If it wasn't for the women that I connected with that shared their stories with me, that made me feel like I wasn't alone, I don't know if I would be sober. I mean, I don't know if I would be. They told me their stories, and I identified with them, and I felt safe. I didn't feel alone. And most importantly, I had hope. These were people that were around me that shared their stories. I was like, whoa, you're worse than me, and you're sober. I was like, now that. You're going to go toe-to-toe with me with stories and be worse than me? I trust you. I like you. And you've given me more hope than I've had in years. Because if you can be sober, maybe I can too. Just enough for me to stick with it and to continue on. So my success is based around a 12-step program and then taking the 12 steps that are within the program, and the people that I got to meet while I'm there that are still the ones that keep me sober today.
excellent. Thank you so much for sharing. Thank you. Katie, first, we're sorry about the loss of your sister, and we were wondering what difficulties do families that are dealing with this go through on a day-to-day basis?
I haven't been in public that much since my sister passed away in February. But I'm really thankful that my family and even my sister was open, and we talk about it. We talk about it with her. We talked about it with her children. And I like that my mom is bold enough to talk about it too. I think one of the things that you said, Amanda, that stung the most was when you were talking about hope and the hope that those women gave you. Because we hung on to hope for so long. For so long. My sister started using drugs at 15 and she died at 40. And now our hope is gone. It's crazy to me to think that, to talk about my sister as if she, when I have to say she was, I still can't wrap my mind around it. And that's my sister. She has 2 kids. And her son's dad is gone too, who died from a drunk driving accident. And so I've got tissues over here. But I mean, I think this conversation, I'm also really thankful that you initiated it, because as we're going down the line, all I could think about is why I wasn't a part of this conversation earlier. And I can't stop thinking about what we could have done differently. And I keep feeling like we could have fought harder. We tried so many different things, but it seemed like she gave up on herself, and it was like the shame that she had is what kept her using. But it was, they found fentanyl, I can't even say, but in her, in the autopsy. But I would say that the effects, my little sister, who's now in her 20s, who's never, from as far as I understand, has never used drugs. She was in high school, and she grew up with my sister in a very different way. But because she was around my sister when she was, growing up, and my sister was in the house because my mom didn't want to throw her out. And it's just like, she would do drugs, my older sister Liz, and beat people up and steal things, and stole my grandmother's car. It was crazy. And she tried to kill my mom once. I was driving once, picking her up while she was pregnant on the highway, trying to get her in my car. And I'm like going to a fundraiser or whatever I was doing the next day, and she's trying to punch me in the face while I'm driving on the highway. It was like when she's pregnant, it was just chaos and craziness constantly. Visit her in crack houses, bringing her food, just trying to tell her, that we would never give up on her. The amount, I can't even count, more than 7 rehabs. It feels like an infinity of rehabs, money and resources and people's generosity. But it totally depleted and drained, so much of the energy of our family. There were times, which I also am embarrassed to admit, that it got so bad that we did wonder if it would have been better for people, better for her kids, and better, easier if she had died. Now that it happened, I don't believe that. I don't believe it. It's it was unimaginable. The pain, I could never know what it would feel like. And I hope that any of you who have family members struggling still, that you get success and you find the programs, that Amanda comes and talks to your family member. But I think I've expressed it. There really is no words to express that agony. And lastly, the horrific way, the dirtiness, and how low that drugs can bring someone and bring their lives is, I still think about how she died, and I can't even imagine it. They found her dead and alone in a hotel room, and the things that my sister had to do, and the things that the drug drove her to do. It's I don't know. I wish to God that we could figure out a way. I'm thinking of Newark and the boats, and I'm how are we gonna stop this? What do we do to stop it? I don't blame her. My sister was strong, and she fought with everything that she had. At different points, she's found God a million times, but she couldn't beat it. Thanks for letting me share.
Thank you, Kenny. Next, we're going to ask Father Rick, how has the faith community in Somerset Hills responded to address the opiate epidemic?
I feel like we just need to take just a moment. Like I need a moment. Thanks for having me. It's an honor to be up here. I'm not sure what I'm doing here among all of this, but I'm glad to be here. So I've worked in churches for nearly 20 years. I've worked in churches in inner city Atlanta and rural Appalachia and now Basking Ridge. I literally left a town of 1,000 people, a coal mining town, and moved into off Finley Avenue. So wildly different. And one of the strings that holds all those places together is the despair that comes with addiction. And I've seen a lot of people in the inner city and in rural America and right here, right where your sister was at. And it breaks my heart and changes me every time. As I think about it, just from my perspective, and I'm not like studied in this, I don't have a master's of public health in this. I'm just sort of armchairing this or pewing this, and I see the opioid epidemic as the nexus of a couple things going on. And I do not mean that every single person that struggles with addictions deals with all three of these things, but just on a macro level. One, I see a crisis of well-being. And I would almost say mental health, but I think that has a whole other level to it. I mean, I certainly mean clinical depression and clinical anxiety, but I also mean the feeling of a lack of belonging, a lack of connection, a lack of community, a lack of hope. We know that diagnoses of clinical depression and anxiety are going through the roof. I'm sure there's probably enough anecdotal evidence to say all the rest of it is as well. And it does not surprise me at all to see addictions rise as all of that goes up too. So that's the first piece. The second piece I see is corporate greed. The companies that produce and distribute tons and tons of these pills and flood communities. Little towns with little pharmacies that have enough opioid pills to give everyone in the community dozens or hundreds of them. There's something wrong with that. And I lay some blame there. I'm happy in the last week I saw there was a large judgment laid down and hundreds of millions of dollars several corporations are having to pay out. It's not enough. The third piece I would say is a lack of awareness. And some of that, every epidemic has a level of lack of awareness. It doesn't matter if it's swine flu or AIDS. We don't know what we don't know. And some of that is innocent. And we've heard some of that, people that just leave their pill bottles in the medicine cabinet and just forget about it or think like that can't possibly do any harm. And then there is more probably willful ignorance in the overprescription of pain medication. And I'm glad to hear that we're making progress on that. In terms of the faith community, the first one, the crisis of wellness, the faith community, regardless of the religion, regardless of the creed, regardless of the denominational stripe, one of the things we are set up to do in communities is to help people find connection, find community, find a sense of direction, find hope. And the faith communities can do a lot of things wrong, but I've seen communities that do almost everything wrong and still manage to be a place where people can gather and find community. And so from my position, on Findlay Avenue and Basking Ridge, I would say that the churches of the Somerset Hills are probably doing as good of a job as we've always done in that regard. Maybe by mistake, maybe by design, I don't know. As regards the second, corporate greed, to say we aren't doing enough probably is dramatically understating it. I don't think we're doing anything at all. Churches, synagogues, houses of worship are traditionally places where we tend to be moral sounding boards, and I can take some of the blame for this. I'm not addressing it in my own community, and I haven't heard of anybody else from the pulpit talking about this. We live in an interesting environment. We're not in some community in middle America that's 500 miles away from the closest pharmaceutical company. And so I feel like houses of worship could be a part of the conversation, or even just start the conversation. The last one, the lack of awareness, I feel like is the one place the churches in the Somerset Hills are making ground on, and I would have to give huge kudos and applause to Community in Crisis for that. Community in Crisis has been intentionally gathering clergy, gathering lay leaders to talk about what can we do in general, how can we reach our young people. Not this past weekend, the weekend before, we did a recovery weekend where 9 houses of worship in the Somerset Hills focused what they were doing that weekend in worship in some way on recovery, talking to adult education groups, youth education groups, sermons, resource tables in the back of church, and then a bunch of us gathered, made a walk down to Bishop James Church and gathered there as a whole community, and talked about and prayed for and remembered those who we have lost. I think if you took a snapshot of our houses of worship 5 years ago and then today, it's like night and day. I'm excited to see where we are 5 years from now, because I feel like we're just gaining momentum. So,
Thank you so much. Prosecutor, Katie mentioned fentanyl. Do you want to talk about how that has been winding its way into the community?
Yeah, it's the DEA and the federal agencies are cracking down on it. But it is extreme. If heroin is lethal, fentanyl is 1,700 times as lethal. I mean, I'm not a doctor, but I know a little bit about the chemistry of it. A pin needle's worth of it will kill you. And it's interesting, those that are suffering from the disease of addiction will tell you they sometimes seek out heroin laced with fentanyl because they love the high. And again, Amanda can speak to this more intelligently than me, but for them, it's the same way that all of us in this room need air to breathe. They need that. They need that high. I feel compelled to just kind of touch upon a few things. Again, Amanda, Katie, thank you for sharing your stories. It's extremely raw, it's extremely emotional, and I'm sorry for your sister and your family's loss. And Amanda, that's awesome. Just flat out, it's awesome what you're doing. You know, Katie, you said something, I wish there was more you can do. One of my best friends is a recovering alcoholic. He has this webpage called Alcoholic Next Door. He has a Facebook page. He's awesome. And I think it's true, Amanda, you'd probably say this, that someone that's going through that has to want to help themselves. Because my friend, Andrew, I many times tried to lead him to the water, but you know the old saying, you can lead a horse to water. So what do we do, or at least what do I do? It's education. I mean, I appreciate everyone in this room that's here, but quite frankly, this room should be packed. This room should be completely standing room only. And that's the frustration I have as the prosecutor, is that, you know, that's kind of the ostrich with its head in the sand. People don't understand the magnitude of the problem. And not that I want to, you know, divert the conversation about opioids, but it's substance abuse in general and our kids that are going through this, the anxiety. I think you touched upon it, Father. There's a ton of anxiety with our youth. And, you know, it's something I give my dad credit for. And when I was at Ridge and I thought I knew everything, because every 15, 16-year-old knows everything. He would say, Michael, I'm your father, I'm not your friend. And it's kind of like an adage that I say to the schools when I go and speak to parents. And I'm quick to say, I'll never tell anyone how to be a parent, because my wife's here in the back. We have a 10 and 8-year-old, my friend Elizabeth here. We can barely figure out how to do it on a daily basis, but we remind them consistently, the answer is no sometimes. Or the answer is, you know, no, because we're your parents and we know what's better for you. And I think those are the conversations that we need to have with our youth, is be involved with them. It's not a foolproof plan, because I've met many people that come from great homes and great upbringings and all that, and they still go down that rabbit hole, unfortunately. But I think it's at a bare minimum what we should be doing. And again, it's all about collaboration and the clergy. I mean, I'm not picking on the father here, but since he's here, look, I'm Catholic. I go to St. James. I don't need to hear another reading from the Corinthians. What I need to hear is Amanda. And I think an entire church at St. James, I'm just picking on St. James because that's where I go, where there's literally 300 people on Sunday from 9 to noon, they need to hear Amanda's story, because that's what's going on. And again, I'm sure I'll get dinged for that when I go to the pearly gates, but I'm just very real. If you guys don't know, I'm very candid and to the point. So that's what I'd like to see the clergy do, is start having real conversations with real people that are members of your clergy or your temple or your synagogue. I totally went on a tangent, so I'm going to shut up. But again, for me, it's all about getting out there and just educating and having raw conversations. Again, it's real emotional, and I, again, give you both credit for putting yourselves out there in front of this audience. But I think you just left an impact. So good job. Keep it up.
Absolutely. Thank you, Prosecutor. Jody, we talked about prevention, and I just want you to share some of the programs that are available here in the community and what's been happening with regard to prevention.
At Community in Crisis, we have kind of two pillars that we're working on right now: prevention and education on the front end, and sobriety support initiatives on the back end. So prevention, we've been trying to go into schools. We've brought things like Chris Herron into the school, who, by the way, was extremely impactful for it, because we could hardly get in the door. In fact, at the beginning, we didn't even have the principal come to the first display, and we spent all this money to have Chris Herron, and the principal didn't even show up at Ridge High for the first showing of Chris Herron. But having somebody that they could relate to see, to your point, this could be me, because he said, I was the guy I started with the solo cup in the basement of our parents' home, and this is where I ended up. So showing that trajectory of where you went. For me, it was even a younger person. If anybody knew Julius, they've started an initiative with him. Julius, I was fortunate enough to meet with 5 people in recovery at that point, to find out how does it start? How does it start? And he said, I'm an experimenter. I had a lot of anxiety and depression. I was the kid that didn't quite fit in, or he saw himself as that kid. And so what if he's doing something to medicate away from it? So it's either they're killing themselves, as you see the suicide rate is up, but you're also seeing them medicate away from it. And let's just move it up the grade to how further till you get to the place where heroin, and as you said, I tried heroin and I was at peace. He goes, I felt at peace. So when they get to that drug, it's like they've gone home. He said, I loved heroin. And he goes, now I hate heroin. I've ruined my family and all this. Unfortunately, this young man did pass away as well, but he had offered to do a Scared Straight video. So what are we doing to get back to the prevention part of it. We're going into the schools every way we can. We're going to the PTOs. We've got a vaping display in the back, because obviously there's a progress from usually alcohol, trying things and going up that pathway and eventually ending up there. So is it a gateway drug? Yes. And a lot of the vaping, I think they said the study shows 30% of the kids at Ridge High are now vaping, and much of that has marijuana in it. So, it's going up the trajectory. So we're doing vaping displays. We're trying to reduce the supply. We've done everything from going to realtor's office, because drug seekers go into open houses and try to go in medicine cabinets and find that. We're doing a lot of medicine cabinet management, either with physicians and with public groups. We've gone speaking at many different public groups right now. We've got a partnership with Atlantic Health, and we have now 167, I believe it is, medical groups that are using our co-branded materials, everything from teaching, obviously athletes that get sports injuries, coming up with the opioids and moving on. So we're using a lot of our marketing materials to prevent it, get it out in physicians' office, so it's pick up and grab and getting the physicians themselves to talk about it. We just got a statewide grant to do chronic pain management. Believe it or not, it doesn't stop at the young adults. There's a lot of people that are addicted chronically to pain, Percocet and OxyContin, that have been using it for years and years and years. So we're trying to go into senior homes and try to get people off of it, educate them on what's going on, and get them off it. Again, we're trying to address the mental health issues as well. We're doing mental health first aid. A lot of their friends, I know when we started this, I ran into one of the lacrosse coach at the high school, and said, I'm really glad you're doing this. And she said, but they all know who's using in the high school. So they knew Amanda was using it. So we're all turning away, and instead of extending to Amanda, if we knew Amanda was using, why, if you knew she had a disease, would you not help Amanda with the disease? But we didn't, and your sister. We didn't. We knew they were there, and we turned and we said, well, let somebody else handle that. That's a family thing. But it isn't, because we know what happens. We know where this leads to. Now we have proof of it. So we need all together to come about that. One other thing we're doing right now is a lot of sobriety support initiatives. We're trying to keep people sober, okay? They've got sober, but one of the things is you're very isolated. You come back, you don't have friends, you can't go back to the same niche you had before because they're maybe using still, or they're doing habits that you don't find healthy and useful anymore. So we're trying to really expand on the sobriety support initiatives. It's not too many places in New Jersey that are doing that right now. Everything from sober yoga, cooking classes. We have a monthly coffee house where people can convene, get together. It's open mic. You can do karaoke, whatever you want to do there, but just get together and find other people that are trying to maintain their sobriety. Come to the hub and see what we're doing. We've done things with the middle school. We have middle schoolers coming twice a year. They come and do volunteer work, and then they learn about healthy living and try to support each other. We have a youth leadership council that's getting together. So if you have any teenagers, please encourage them to come to our youth leadership and help other people. And they can help be that person that identifies their friend in need and then helps put out that olive branch to get them into sobriety. Again, remember, this is a family disease. We can't leave them all out there. These are our families. We have 3 support groups now. So if you are a family that is struggling with this, we have a family support group every other Thursday night. We have a addiction counselor that's there that's going to help you find it, and other families that have been going this so you can navigate your way through it. We have a grief support group, so if you've unfortunately lost somebody, come and you can support each other. And then we have a peer-to-peer support group that's started so that parents can be like, it's the old, if I had known now what if I'd known then what I know now, I would have done this differently. It's a peer-to-peer group so that you can help other people move across this. So go on our communityincrisis.org, get involved. We need you as a volunteer, but we also need you to bring people to these recovery initiatives that we have so that they can maintain their sobriety, and tell us more about what you need to help you support that sobriety, because that's what you're our best source of information, people that are in recovery. And one quick shout out, he didn't serve himself very well, but he has been way out in front of the recovery. Their church has really been preaching from the pulpit for a long time, and I appreciate what you've been doing, and that you've been a real leader in this, and thank you for supporting us and the community and what you're doing.
Thank you, Joy. The next thing we're going to discuss briefly, and we'll ask Amanda, Katie, Father to join in. We want to talk about stigma, because we know that's a huge obstacle for people to get help. And we're wondering what your thoughts were about how we can break down that stigma. What are some of the steps that people can take to break down that stigma? I mean, anyone could start. Amanda, you want to begin?
Yeah, we're going down the row. Okay. Gotta keep me up to date here. It's interesting when you guys were discussing, or I was across the board about stigma, and I was thinking about the barriers for me, and I'm thinking to myself, what was that stigma like? And Unfortunately, I want to give you an answer, and I don't have one. So my answer is I don't know. I don't know how to, but I know something like this will help immensely. The more the community in crisis building, the more we are talking about it and we're not scared, which just makes me want to say, when I said yes, so I said, people always said, when recovery comes knocking, you always say yes. So when I asked, do you want to speak at this? I said yes. And I hung up the phone and I was like, it's in Bernardsville? I work in Bernardsville. All the families that drop their kids off at me as their preschool teacher could live in Bernardsville. Was this a good idea? And I went right to my boss and I said, just so you know, I'm doing a town hall. It's for community crisis, Knock Out Opioid Abuse. And she was like, that's amazing. I'm so excited for you. That's awesome. So, and I'm telling her because I want to make sure that she knows what I'm about to do. Like, I wasn't going to not do it, but I wanted her to already know that I was doing it. And it's funny, but it was like, well, why? Why? Because I'm scared. So stigma was going to hold me back from getting sober because I didn't want people to know who I really am, what I've really done, who I'd become. I'm a mom. Moms don't do drugs and drink. I have to tell people that I'm a mom and I'm a drug addict. If you came from my family in my town, you're not a drug addict. You're a Basking Ridge alumni. You don't do drugs. I have a college degree. I must not do drugs. I'm a preschool teacher. I can't do drugs. People are going to look at me differently. And the fact of the matter is, I was looking at myself in the mirror before I got sober, and I thought I was garbage. I thought I was trash. I thought I was worthless. And I honestly, truly believe that if you knew who I was, you were going to feel the same way I did about me. And I didn't want you to know that, so I'm going to hide. And so stigma is what kills people. And on the flip side of this, I almost didn't want to show up to your night. I mean, I really wasn't going to not show up, but I was afraid. My knee-jerk reaction after I hung up the phone was, I don't know if I'm allowed to curse. Oh, no. I don't know if you're allowed to curse. People, the parents are going to know that I'm a drug addict, alcoholic, and you're supposed to say in recovery because I don't want people to just assume that I'm still using, so I got to finish it with in recovery. You know, but I almost didn't want to come because I didn't want people to know that I'm a drug addict, alcoholic in recovery. And what would happen then? Then I wouldn't be here. Then I wouldn't get to be the person that's alive, that's sharing her story that could help somebody else. So the stigma on the other side is I'm not going to talk, and then I might not be able to save somebody when other people were willing to talk and they saved me. It's my responsibility. I feel like that's what they told me. And I believe it, you know?
Thank you. I think we have seen an example of breaking down the stigma tonight, that's for sure. Father, do you want to comment as well?
The one phrase that's been like bouncing through my head ever since Jody said it was, this is not a casserole disease. And it's so true. I mean, I feel like at least our clergy group and the churches and synagogues and other houses of worship that are involved in that are doing a good job of saying, hey, there's a problem. And we're talking about the problem, but we're still not able to wrap our arms around people in the way that we would with someone that is having open heart surgery or going through chemotherapy or had a baby where there's meal trains and there's calls and there's flowers. And I don't have an answer to your question other than we need a sea change to be able to make that happen.
And I would add to that, not only for those who are in the addiction, but their family members and especially for their children. And from, my sister's children that are, her son is, he's 11. Was he 11 or 12, Mom? My mom came, she's 12. My mom's back there. And 9 is her daughter. And it breaks our heart. Like recently, he's not invited to certain things, to birthday parties. There was a time, he had a friend that was down the street who's actually 2 and maybe even 3 now, I'm discovering. Their parents do not allow them to hang out with him anymore. They stop them from hanging out. And he's little and he makes up these stories in his head of why, but we know why. And it's heartbreaking. And in the house that me and my sister grew up in, my uncle, my mom's brother, died of a heroin overdose. And so we saw that. And of course we were we got treated weird. You know, people thought we were, we always felt like we were the other side of the tracks, like we were unworthy. I don't think we understood it. And I also understand being on the side, because Manny will come home and be like, I heard that this kid does that smoking thing, whatever you're talking about. And I'm like, stay away from that kid. Like, because I get it a little bit. I'm not a parent, I'm an aunt. But I also understand the fear of trying to protect your children. But there's got to be something where we're human to each other. And I think the thing that stood out to me, one of the, Amanda, of course, you being here alone stands out the most to me. Like, but what you were saying about the sense of community and belonging, that is, I don't know what the studies are. I was asking my husband on my way here, I'm like, can you share with me, what does the data show of how to prevent this? And I don't know what the data is, but something tells me if we loved each other, if we cared for each other, if we weren't afraid of each other because you make different, you have a different amount of money, or you vote a different way, or you smell, or whatever it is, like, I don't like your lawn ornament. Like, if we took care of each other, and we see examples of that, in our community, we have Heartworks doing that, but it shouldn't need to be an organization that's doing that. It should be us doing it for each other, and I think that ultimately would be massive. But I think obviously I'm not saying we can't, we also intentionally need to address it. And since I'm here and I have the mic, please, if you have kids at Bernardsville schools, like, talk to them and know that my niece and nephew are there, and love on them specifically. They need extra love from this community now that their mother is no longer here.
Thank you. So, I will tell you, this is my 29th time moderating town halls from the last 3 years, and by far this has been the most impactful for me personally, I'm sure, for all those that are watching and those that are here today. So we want to thank the panel for doing an outstanding job. They're really fabulous. So we're going to ask the panel to stay here. We're going to, at this point, invite Chris Schroeder to come up. Chris is a person in long-term recovery. He's a board member at Community in Crisis and a board member at the National Council. You want to, for drug dependency, and Chris is going to share a little bit with us.
Good evening, everybody. What a great panel. This is just absolutely amazing. I got involved with Communities in Crisis 2 or 3 years ago, and I just want to share a couple of things about what they're offering as far as for the recovery community. On Tuesday night at 7:30, there's an AA meeting that's got some really good attendance. Wednesday morning, there's a Noble Steps meeting because there's more than one path to recovery, and that's going really well. And there's a Drug Addicts Anonymous meeting on Thursday night at 8 o'clock. It's your chances of being able to stay in long-term recovery are infinitely improved if you get involved with some type of community, some kind of participation in a recovery lifestyle. Another thing that Communities in Crisis offers is actually, this is something my wife does. She's been with me for over 10 years, so she's really been involved in recovery events and everything like that. And she was a hospice nurse when I met her. So she was really good with families in crisis and clinical assessment. So she kind of has become the navigator for Communities in Crisis. So if you're a parent and little Joey is doing some things that you don't really want him to do or something like that, and it's time for some type of intervention or some type of treatment, Andrea will point you in the right direction. She has relationships with dozens of treatment centers, and she can really help you pick the place that's going to be the most impactful. I also want to say the churches, I want to thank them, because for the last 30 years, we have been meeting in church basements in 12-step groups. And, I cannot tell you how many lives have been saved in those basements. So absolutely, thank you for that. Thank you for that. And that's all I have.
Thanks, Chris. Okay. Yes.
When I saw the whole panel and saw the drugs that he was doing, and I didn't want to wake up one day and go downstairs and find him dead in his bed. So we had to make some tough decisions, and it is not an easy world to navigate. And the thing is, if you don't do something, you're going to regret that you didn't. So we're still struggling 8 years later. He's been in and out of places. I'm trying to remain hopeful. But it's the denial part in the parents. And I don't know who's here or who's not here. If you know somebody and they need to reach out, they should, because if you don't do something, you may regret, why didn't I do it? So we're here at the Community in Crisis. It's a wonderful place, and we're available to help answer parent to parent, Dottie and I, if you want to talk to us in confidence, cell phones, whatever you need. Thanks.
Thank you.
If you want to talk to my mom, raise your hand. I'm offering. She's open and she's bold, and in front of the casket, no joke, at the funeral in February, in front of the casket. This is one of the strongest women, I'm telling you. She's talking to addicts at the funeral, telling them, begging them with tears coming down her eyes, this is gonna be you if you don't get clean. Like, please, as a mother, please, and like begging them. And oh, sorry. So, talk about strength, and she's very open about her own story too. So that's my mom.
Thank you. Yeah, if people just want to come up to the microphone and right in the front here, just because we're live streaming, so it's much easier. So if anybody wants to come up and ask some questions, please just walk right up.
And I also have to say thank you to everybody who has helped us, because the community has been so supportive. Police officers, schools, Heartworks, neighbors. Thank you to everybody. It's been very helpful to us.
Absolutely.
Allie and Joe.
We do have some questions for the panel that came in prior, so we can start with that. And if you want to develop your question and come up to the mic, just please walk right up. One of the questions was, how can I learn to use Narcan here in Somerset Hills? And do I need a prescription for Narcan? So maybe the doctor would like to ask that, or Jody.
Is this working? Yeah.
Yes.
You can now get Narcan at the pharmacies locally. CVS should be stocking it. In fact, we were trying to test them on it to see that they had it. So you can actually get it without a prescription right now. We've been holding Narcan trainings. We had one actually at our recovery walk a week and a half ago. I think, were you doing it, Alton, in the back, teaching a little bit? So are you still available afterward for anybody that might need? So if you want to go home and still know how to administer it, I think it's a great idea, because anybody that might have this in their home should actually know how to use it and have it available, 1 or even 2 doses available at the home in case something, God forbid, because we're taking down the deaths. I think still this year it's going to eclipse 3,000 in New Jersey. I think it's on track for that. But it is starting to trend down lower nationally, and much of it is because of Narcan and people knowing how to administer it and being their first line. So please make sure that you avail yourself of that, of the training. And if you check our website, we'll be having more coming up.
Okay. Thank you. We did get a question from someone who's viewing this. As a parent, what should I do if my doctor or dentist prescribes my child an opioid?
So, am I on? I'm on, okay. So I do want to say that although we are seeing a downturn in the number, both nationally and in the state of New Jersey in the last couple years, we have seen a downturn in the number of opioid prescriptions. So that's probably a good thing because we were probably way too high. On the other hand, I will say, as a physician, obviously there is pain and we need to treat pain adequately, okay? So I think I would tell that parent a few things. I would say, and this is what many parents, because we do a lot of, one of our centers, we do a lot of dental for especially teenagers having wisdom teeth. So I would say, number one, have a conversation with your physician. Do I need this? What are the risks and benefits? Do you have any information about it? How long should I really take it? What's the length, the average length that a kid might take this for wisdom teeth? Talk to your friends. Did your kids need opioids? How long did they need it, et cetera? Secondly, I would ask, what are the alternatives? Ask your physician, what are the alternatives? And can I use the multimodal analgesia? Can my child take Tylenol and Advil together, let's say, around the clock for 3 to 5 days and add the opioid in only as necessary? I mean, these are all reasonable questions and things that, the layperson can ask. The other thing I would ask is, can I partially fill my prescription? So the answer in the state of New Jersey is yes, but then you cannot go back. If you have a prescription for 30 pills and you only want 10, well, then you have to go back to the doctor if you need more than 10. So I just want to make sure that everyone understands that we are now seeing some unfortunate instances where, let's say, patients with long-term cancer pain, et cetera, are not getting adequately treated. And that's a problem too. So we need to come back to the middle, to what is reasonable. I mean, for example, if you have surgery, it is a reasonable expectation that some amount of pain, an acceptable amount of pain, may happen after the surgery. We're not looking for zero pain, we're looking for a tolerable amount of pain. And so you may have to say to your kids, you might be a little uncomfortable, it's not going to be horrible, and we'll work through it together. Thank
you. Yes, Jody.
Let me tag on to that. If you did get prescription that you did not utilize, there's a drop-off at the Bernards Township Police Station, I believe Bedminster now too. And we also have bags at Community in Crisis that you can come. Malincrot donated, I think, up to almost $30,000 worth of bags, doTERRA bags, that you can put the pills into, put a little water in it, and actually throw it out in your own garbage can. And we have those for anybody, and including police departments that want to have it. So please make sure you also discard of the meds if you do, in fact, fill the prescription.
Excellent. I think we have.
I just want to
Yes,
add one
Doctor.
thing to that. So at our surgery center now, we also have information that we've created based partially on the CDC's, know before you prescribe, and then also know before you take narcotics. And we have a conversation with the patient before they leave, and we say, here, you're going to be prescribed a narcotic, here are the risks and benefits, here are some questions you might want to ask, talk to your doctor. So we really have created a dialogue. And we're, like I said, we do about 25,000 cases a year, so we're pretty busy. And I think that we cannot be alone in that. I'm sure that other centers, and I know hospitals are now doing that. I know it's being discussed in a medical school curriculum. So things are changing. It's more of creating a dialogue between doctor and patient. That's the most important part.
Yes, we have a question.
My question is, where can we learn more about addiction and recovery? And can you say something about Vivitrol, or can you say anything about, recommend books to read or movies to watch? Or, I happen to have been affected. I've seen active addiction. I've seen recovery. I'm on the first aid squad in Bedminster. I've seen Narcan. I've seen it work. I've seen needles in people's arms. Like, where can we learn more? I feel like, the community could take something, a resource and share with family and friends who aren't here, who didn't hear it, who didn't watch the live stream.
Yes. Thank you for that question, especially the medically assisted treatment portion of that, because we haven't touched upon that tonight. But maybe we can talk a little bit about medically assisted treatment and how that's now part of the whole process in many cases.
I would probably defer that to a medical professional. I used to be a PA, but I'm not doing that right now. We have a lot of resources on our Community in Crisis website. I know that you have many resources on your website. If you're directly affected, again, you can start with Andrea Schroeder with us. We are about to also We just got a grant to hire a full-time person for recovery support. So that person hopefully we'll have on board by December at Community Crisis. So we're going to have a lot more resources for people that want to navigate the process. But I would start exploring the websites, and again, you know, reach out to your medical professional. If you're going to need to be prescribed something like Vivitrol, you know, you're going to need to find a facility that's going to be able to do that.
One of the things, by the way, we did, law enforcement in conjunction with our first responders, is a lot of the families were asking the police officers who were, or the EMTs that were administering Narcan, in a state of desperation, where do I take my loved one to get the help they need? And so every police officer in their vehicle has a start packet, it's called, and basically it's an envelope that has the resources available and out there. And then the evolution of that was, I'll try to do this as quick as possible. When EMTs respond to a Narcan, an individual can RMA, refuse medical attention. And so what I've asked Somerset County is primarily volunteers, with the exception, I think, of North Plainfield. I've asked them to candidly have the conversation with them to not RMA them. I mean, and these guys, men and women, by the way, they do a phenomenal job, the EMTs and the police, about coercing them, and I use that word in the right way, to get them to the help they need. And so Robert Wood Johnson, by way of example, has a recovery program. I know Morristown has one as well. And those people are folks in recovery. They're employees of the hospital. And because, as I'm sure Amanda and anyone else that's dealt with this could relate, when you Narcan someone and ruin their high, they are super pissed off. Mm-hmm. And unless you are recovering, or someone in recovery, you have no idea what it's like to have that conversation with them. And so these recovery coaches, they're called, that are at Robert Wood, and I'm just using them because I interact a lot with them, they're there, they're bedside. So the minute these guys are in a rig taking it to Robert Wood, they're on the phone saying, we got a Narcan deployment, send in the recovery coach, and they are there. The nurses do their thing, the doctors, and then they are right there. And so we've seen a massive uptick from 0% interest in recovery to the recent numbers were like 82% of addicts taking advantage of this recovery program. So that's one resource in terms of, to answer your question, like how do we get the information out there?
Thank you. John?
Just as a matter of disclosure, my name's John Evangelista. I'm part of the medical affairs team for Titan Pharmaceuticals. We make an MAT, implantable buprenorphine product. To answer your question, the best place to get information is to go to the American Society of Addiction Medicine's website. They'll talk about Vivitrol, they'll talk about Suboxone, Probufene, which is the product that we make for recovering addicts. Our product is a 6-month product. It's implantable. It releases a buprenorphine over a period of 6 months. But the asam.org is probably the best place to get that type of education.
Thank you, John. Okay. Are there any other questions from the audience? Want to come forward? We do have a couple other questions that we have that came a little bit earlier. Youth athletes are particularly vulnerable to opiate dependency and addiction because of the injuries they suffer. Are there any efforts in the area to provide athletic families with children and athletics with information about this particular vulnerability?
Yeah, absolutely. We actually created a piece, and we've used some of your support material for athletes. We've addressed the coaches at the high schools, and we've invited the captains of all the sports teams. I had read a statistics once that said if you had take an opioid before the age of 18, you have a 30% greater chance of becoming addicted later on. So obviously they've gotten either from a tooth extraction or some kind of an injury, sports injury. So athletes we know are particularly vulnerable. And circling back to how this community in crisis started, one of the people that overdosed was one of the captains of the Ridge High football team. So we know that it's affecting athletes in a much higher way. I mean, we've seen it. So we're going after the coaches. We have support material. Atlantic Health is circulating a lot of it. Again, we co-branded with them, and we're pushing it out to the orthopedic departments. My husband, full disclosure, was an orthopedic surgeon. I had him actually address the entire orthopedic department at Morristown Medical Center to talk about it and be careful about their prescribing habits and really educate them on it. So we are trying to push it out through different modalities to make sure that all the sports teams ahead of the season are knowing it, to ask the questions. The parents, you all have to get in there and ask the same question. does my son or daughter actually need this? Are there some alternative pain options out there? And we've tried to put out the source material to as many physicians as we can. We put out the, an information piece that parents can pick up. We have posters in the offices for a lot of, whether they post it or not. We've created a lot of material so that we're really trying to get the word out, particularly to the most affected, one of the most affected population, which are athletes, unfortunately.
Thank you. Another question we received is, as a resident of Somerset Hills community, how can I make a difference in addressing the opiate epidemic in my everyday life in my community? Anybody want to?
I was saying a little bit just about, I think one simple thing, and maybe you can be, maybe others can be more specific towards drugs, but I think by being kind to the people around you, and I think that sounds cliche or silly, but it's really not. It's when you're stressed out in the supermarket. I mean, we use these examples, but it's your everyday, where you are, the people that you're encountering at the parent meetings, at the school, everywhere you go, at the bank, in our community, at work, in preschool. It's being kind to people and people who are different from you. And I think that's where it starts, but maybe there's something more specific to drugs.
We've never been more connected, but we've never been more disconnected as a society right now. Kind of the opposite of addiction, because it's social isolation, anxiety and depression that's leading them down there, is connecting them, bringing them back into a supportive community where there's socialization, healthy socialization, where you're taking care, self-care, and expanding your spiritual life. I believe that's a big component of trying to get well, is learning who you are, accepting where you are at that point, being present for other people, not just yourself, but self-care. So that's some of the initiatives that we're trying to do as well, and bringing into community in crisis. But really, it is what you're saying is a social connection. For the youngsters, they've directly linked it. We've read so many studies with the cell phone. I am trying to get into Verizon. I don't think a child should have a cell phone with social media that they can use on their own when they're in middle school. They are not capable. They text, they sext, they say destructive things and bully on those devices. Give them a flip phone. We had 5 kids in my family. We all are here today without a phone. You don't need to have that device that is really hurting other youth and hurting themselves, because again, it's like, I'm not as good as her. I'm not good in who are, and Chris Herron said the same message you said. What about me is not good enough that I have to drink? What about me is not good enough? And we all feel that in some way we're not worthy or we're not good enough. So here's a child that's evolving and experimenting and trying to figure out who they are, and yet they're seeing on this device in their face 24 hours a day somebody that's better, stronger, smarter. I'm not part of that group. I'm glad I didn't grow up in that time, because I don't know that I would have been here as healthy as I am if I had to compete with all those other people that are better, stronger, smarter, prettier than I was at that point in my life. Remember, we used to go home, even if we were bullied in school, we went home and we had our supportive family from Friday till Monday morning. They got it all weekend long. They never leave that cell phone behind. And so I think the message is monitor what they're doing and who's on that device, because I think it's the root of a lot of the evil, and I think it's a lot of what's caused this epidemic.
Thank you.
I would I would echo some of that. But again, it kind of goes back to what I said in the beginning, which is I'm not telling anyone how to be a parent, because it's hard, but that's where we have to be involved with our kids and kind of teach them right from wrong. Technology is not going anywhere. It's only going to get more sophisticated, and it's going to be used more often. So I think it's just the word involvement, right, and knowledge. And then the beginning part of your question, it's like going out and talking, kind of what you were saying, Katie, and sharing your story and others. And I'm very open and candid with, you don't know it yet, Amanda, but you and I are now friends. So, and I will go out and I met this amazing person named Amanda, who's my friend, and she's dealing with this situation, and she's awesome how she's conquered it. All the people that I've met that are like you, they're my friends now. And so I kind of use this position that I have for as long as I have it to kind of be the voice box, the megaphone, to say, welcome these people to your community. Don't judge them, because you don't until you walk in their shoes. And we all have demons. Every single person in this room, no marriage is perfect. I mean, close, but not totally perfect. You know, no parent is perfect. So we're just all trying to make it, you know? And I think, Katie, you're right. It's like, can we just be a little nicer to one another? It does sound cliche, but I think it would go a long way if we just kind of gave people more hugs instead of being so judgmental.
Thank you.
Yes.
Yes.
I just was going to add really quick. Does it go on? All right, whatever. I don't even. I was going to say something along the lines of what Mike said or Katie said about, don't want it to sound like kumbaya, but I really do believe that it is the connection. But I also think that it just starts with how can we fix something that is so broken? What is little old me going to do? Little old me is going to interact with someone at work that drives me crazy and not pass judgment on them while they're still talking. Little old me is going to not participate in gossiping negatively about somebody while I'm having this like lunch with my friends. It starts with me. If I want to make a difference, I just have to be the better person, a little bit. Not like great at it, but a little bit every day. And so the problem is humongous. And the answer to the question is each one of us can do it tomorrow. Tomorrow I'm going to wake up, I'm going to make a conscientious effort not to judge people because of whatever. Because all of us know you're freaking sitting in your car judging. You're judging. Don't even say I'm not judgmental because you're judging and you're gossiping. And I think it just starts with trying not to. You know, being conscientious, being mindful of that, and being more open to other people. And that will lead you to want to say, are you okay? Is there something I can do for you? You know, and even if you're kind of embarrassed, no, they're going to think this about me. No, they're going to be like, who, me? Who cares? Just, are you okay? You want help? You want to talk? Whatever, you know. That's it.
Mike, you're using your position of power to elevate others, especially those who have been going through difficult situations. I think every one of us have positions of power, whether we recognize it or not. If you're in a community, even you're in a position of power if you're in a conversation and you decide when someone starts talking crap about someone, it's difficult. Like people are asking, what can I do as a community member? How hard is it to just one, not engage in that, or two, to like challenge your friend or the person and say, well, maybe they're struggling, cut them a break. It's difficult. Even if you're somebody who people know are not interested in gossiping, it still happens. So I think it's a big deal.
Yes, absolutely. A question?
I just want to quickly add on to this conversation.
Sure, please.
Another thing I think is important is being aware of the friends that the parents that your kids hang out with, the families that they go to. Are they the families that are having the parties and in the basement when nobody's looking? Being aware of that. And then also, if you know that that's happening, don't participate in that. Or I say we start calling families out, because that is something that definitely happens around here. You have kids Ubering all over the place so they don't have to drive. And, you know, it starts in these homes. So in some situations, it starts in homes. In some situations, they're hiding it from their families. But we have to be more involved in that as well as a community.
Excellent. Thank you for that comment.
Can I add something?
Yes, please.
So I just want to make two comments. One is that I just want us to keep in mind that it is not only kids that we're talking about here, because addiction is adults too. And if you look at some of those, I mean, I didn't show the slides, but, you know, heroin addiction is increasing and opiate use is increasing across all demographics, not just the 12 to 18-year-olds. So, yes, parenting is very important, but we can't also lose sight of the adults in our community who are in need as well. And sometimes that is very shameful, you know, to be one of those adults. I want to make a quick comment about, someone asked something about medically assisted, whether you're talking about medications or recovery support. As recently as 5 years ago, finding a doctor who was able to prescribe something like Suboxone was very difficult, because part of recovery is recovery support. So I would say that now it's becoming easier, both getting medications that assist with recovery support, finding places to, you know, have recovery, et cetera. But, every one of us in this room has medical health insurance, and your health insurance is supposed to partner with you in covering those things, because oftentimes both those medications and those recovery efforts are very expensive and not available to most people. So, you have your health insurance. It is your right to talk to I'm not anti-health insurance, but it is as a physician, but it's your right to talk to your health insurance company and say, I need you to partner with me and cover some of this. So that is something else that we've been working on with Community in Crisis. And I think the health insurance industry is changing somewhat, is covering more of these things, but there is some work to be done in that area.
Yes.
I'm short. I don't even know if you can hear me. But I'm likely to put out there the unanswerable. But Judy, you said something that literally spoke to my soul about this person that you spoke to and how doing heroin, that they had been searching all their life, and doing heroin made them feel home, made them feel safe. So a couple of us here work with the parent organizations at the Somerset Hills School District, and we use our platforms and our social media to advise about this. As it's been said before, this was probably the most I've been to 2 of these and countless others. This was the most impactful evening of my life in terms of any of this. But listening to you say that, and knowing I have a 9th grader, she's definitely a high-stress kid, but knowing her friends and her contemporaries, that is my fear. My fear is that anxiety, that stress, that level here where our kids are functioning, and that one moment of experimentation where they find home. And for us, it is a challenge to get this education into the schools. This night was blasted out on various platforms. These people here are amazing, but they're the people that would show up every single time. And my question is, what do we do? So like Chris Herron is a phenomenal, phenomenal speaker. He's a fortune. Like, we can't bring him into our schools. What can we do to make parents show up? Are there video pieces that we can share? Mr. Robertson, you've been phenomenal with working on us on other fronts and getting into our schools, but how do we meet parents and students where they are, because we're kind of at a loss.
One of the things that's funny, and I was also involved in this years ago, there was a great program that the police had called Project Pride. And I only happened across it because I'm a Bucknell grad, and one of the guys involved in Project Pride that was in our Bucknell world was involved in it. He was a guy, he was 25, worked on Wall Street, had a summer home, had a vacation home, lived in the city, was living the life, and got drunk down at the shore and drove somehow. Everybody saw him stumble down to his room, but he drunk drove and got up. I guess they call it alcoholic blackout because he has no recollection. Got in the van, drove up, and hit 7 church people returning from a retreat and killed like 5 people. That, I think, and so I took it on my mission. We brought it to the high school, Project Pride, because they were Amanda and Katie. They were people that they could relate to because they're close in age to where they are. They sat in, he said, I sat in your seat not that long ago. And they had a diver from the Westfield diving swim team that came as well, a woman who had a child, and she came. And I can tell you, you couldn't hear a pin drop in the auditorium when Project Pride came to Ridge, because those kids were not going to drink and drive after that. I would gather, and I think some of the moms that are older could tell you, no one drank and drove after they saw people that were relatable to them. These people, they're the ones that are going to make the difference. When they get into the heads of these kids and scare them and say, this is why you don't want to do this. And Julius was that guy. Unfortunately, he did not live long enough to share it. But people like Amanda, people like Andrew Missionard that are coming to the high school, those are going to be the kids that make the young adults that make the difference and make those kids say, I'm not going to make that choice. I'm not going to do that. I think that's going to be the most impactful thing. So I say, keep that up.
Yeah, I mean, I meet with the superintendents in the county almost once a month, if not at a minimum quarterly. And it's really frustrating to get the parents out to these functions. And I've gone as far as to suggest, okay, sports, any sort of extracurricular activity, why don't you mandate that they have to come to one of these lectures, right? And you would have think I asked them to create like diamonds, because they're like, I don't know how we're going to fit that in the curriculum. And I don't, the parents, they're so busy. And I'm like, But yeah, like kids are committing, I don't want to digress, but kids are committing suicide, and there's 4 in this area in like under a year and a half. That's crazy. And so, you know, I'm glad Ashlyn and Will aren't here, but I'm like, we talk about, it's not all about getting straight A's. Honestly, it's about being a good human being and doing the right thing and like teaching them coping skills. Again, to go back to the original part of this conversation, it's really hard. But the pushback I've gotten when I've made suggestions is, we don't have the time. We can't figure that out. And my response is like, figure it out. I mean, cut something else then, you know, because you're right. Chris Herron's awesome, but he is super expensive. And, you know, he packs auditoriums. He did it at Watchung. He did it at Ridge. And that place was, I don't know what the capacity is, 4,000 or 5,000 people. It was packed. I don't know what it is. But I don't know. It's just really frustrating. I'm just trying to figure out a way, and I welcome opinions on how to get parents to say, come to this. And other than making it mandatory, but again, they were like, you can't make parents show up for something, that they'll go crazy. So I don't know. I really don't, I don't have an answer. It is. It really is.
We do host a coffee and conversation for parents also at the hub, but again, limited participation, and it's the same bodies that show up, and they're probably the ones that don't need to, you know, to learn about this. But I think sometimes when you go to the kids themselves, I also think, you know, I'm a big believer that you know, if you can hear it in church, you're maybe getting the adults in it too. So the synagogues and church, and this is one of the things, because now we're taking our message and pushing it out even further. And they've, you know, have it in the narthex of the churches and the synagogues, so that people are coming out, they can kind of quietly pick up the literature and learn a little bit more anonymously about it, and or navigate, you know, quietly through the website. So we're providing source material that, you know, hopefully people can learn privately, because again, it's not one of those things, because you don't want to maybe self-identify that you think your kid might be starting to use. You don't want to be that parent, because again, you don't want to be the one shunned at the birthday party because, you know, you might be the kid using, right? So it's a hard one.
So if I could just say, just add to that, instead of, I mean, creating events like this that are sort of extra and where everyone comes, that's good, but getting people where they're already at. I mean, in my church, if I said, hey, we're having a recovery night on Wednesday night, 15 people would show up. Maybe. I'd feel good if 15 people showed up. But we do it on Sunday morning when everyone's there, and it's like, well, here you are. And so you know, if you're tired of hearing 2 Corinthians, then talk to your priest, talk to your rabbi, talk to your imam, and say, can we hear this? And get people have the conversations where they're at. We don't always have to create new spaces for the conversation. So do it where you're going. Excellent.
That's excellent. Yes.
I just wanted to say at my church we had Teen Challenge come and speak for the whole time of the service. So you guys can contact them, and even the schools, and I'm sure that they would come into the schools and speak, and it was phenomenal. And the young kids, I mean, it was made a lot of awareness, so just throw that out there too.
Thank you. Thank you. Well, we want to once again thank the panel for all of the inspiration and really leaving us with a tremendous amount, I think, of energy to go forward and to really make a difference in our community. So let's give them a round of applause for all of that. Thank you. Oh. Do you want to make a comment?
Sorry, I just wanted to make a quick comment.
Sure.
My name is Gina McCready. I have kids in the school as well. And I thought, Sam, your question was awesome. I think I have 2 ideas. One is get them where they already are, is a good point. Back to school night. All the parents are there. Put something out there. The other thing is, and even have it be the teacher or the president or whoever, the other thing is maybe some online mandatory trainings for the parents. Because like I know I have to do an annual code of conduct every year at my job, and every year there should be refreshers, and they're like one-time investments. They'll be a couple $1,000s probably, but at least one-time investments that could continue to be reused.
Excellent. Thank you. That's a great way to close, because what we always talk about is that this is only the beginning of the conversation, that this is really the first step, and we would encourage people to connect with each other I know this is a group that has connected already and works together, but if you're in the audience and you want to participate and you want to get involved, please come up and speak to some of the panelists as well. I just want to conclude by just mentioning a few housekeeping notes. You do have your surveys that we would ask you to please return. There is a Apple Watch that is going to be raffled off as part of the process, so please put in your surveys and you'll get admissions into that raffle. And also, we want to once again thank each of you, most importantly, for taking the time to be with us tonight, and we hope that you have gotten as much out of it as I know I have, so thank you very much.